40.
What is the 40?
4000.
Yeah, what does it mean?
40.
Very thin.
Very thin.
Very thin.
Very thin? This is what I said we commonly use.
Half circle.
Yes, this is a half circle. Okay. 40 means that is the needle size what we use. If it becomes 50, 60, it is more thinner needle, smaller needle. If it becomes 30, 20, thick, bigger needle, like in general surgery we will use. Okay. We in dental we'll use 30, 40. Plus, it is silk. Non-absorbable means you have to remove it later. Right?
Removal. After 7 days.
After 7 days. Okay. This is the total length of the needle. Okay. The suture material. 75 centimeters.
That's the suture.
The suture. 16 millimeter is the
The needle.
needle. Khalas? This is when it is manufactured. Okay. This is the expiry date, 2019. Good. No problem. Khalas?
That's the expired.
Yes.
19.
Yes.
7 years. Yeah?
No problem. This goat will not complain, so it is okay. Fine. It is sterile or not?
Yes, it is.
It is sterile. It is written, no? Sterile. Okay. So all these details you will check. Then see, it is written 2 cross means don't reuse. It is a single use. That's why saying no to be used 2 times.
The suture.
Yes, don't use it 2 times. That means don't after you use, dispose. Everything. It can be, but they said don't use, so don't use.
The suture.
Okay? Needle will not cost too much. Okay? So that is what we have. Needle holder. It is inside. Wait. Needle holder. I told you, see inside.
Yeah.
Okay? The serrations are there for the grip. Okay? This is the ratchet. Lock.
How do you open it?
This is locked. This is locked.
Yes.
Lift it. Lift it. Press and lift it. Try.
Can you show us the grip?
Yes.
I can like this, but how do you
See.
do it?
See. Now it is open. Okay. Locked. Then press it again and lift it. Try.
تضغط نزل
لا كان كي
ايوه تحت اول شيء
تضغط
اضغط نزل
خلاص فكه
اول شيء اضغط على تحت وافتح يبيده شد
ورا
Okay.
سيبها شوف طيب
Aywa. Good.
شوف عمرك تجرب
See, you can use which finger you are comfortable with. This
Index
or
finger
this.
and the
Okay?
thumb.
No problem. I usually use my middle finger. So this finger I can use if I want to support like this. Okay? Or I can use this and use this finger here. No problem. Anyway, whichever you are comfortable with, you can use. No problem. Okay? Alas, now let us see. Now we will take this, pull it out. Okay?
The suture came
There will be a packaging like this. Okay? Now see, maybe your assistant, they can touch on the external, but they should not touch on the internal. That is for you to do. Yes? Then you will unpack it. Okay? And ideally you should use this, or you can just don't poke your hands and take it out. This is your suture material. Okay? Now you see here, can you tell me, is it swaged or is it eyed?
swaged
Swaged. Look here. Swaged. Right?
Yeah,
There is no
eye.
eye. There is no eye. Swaged. So this is less traumatic to the tissues. Khalas? Now, tell me, where will I hold it?
230. From
54.
here it should be 2/3 or 1/3 will be enough.
3/4 from the point.
Okay. So that is somewhere here.
Yeah.
Correct?
Middle. Yeah.
Correct? And I locked it. Why did I lock? Because if I don't lock, when I am pushing through, it will come
Close.
like this. So I will lock it.
After you lock it, doctor, you can change the position of your hand, yes?
I can. No
You,
problem.
you don't have to hold it with
You
a...
need to press all the time.
No problem. It's locked. Now I don't have to do anything. I don't have to worry about holding it together. It is locked. Now you see. Say, if I say I'm going to suture here, for example, okay? Now the way I hold it now is wrong. Why? How will I place? I cannot do. See? No.
Direction.
So the direction of how I held it is wrong. This is correct. Yes? So I can pass it. Plus? Okay. Now where is the okay. Let us see. Now the thing about this is, incidentally, you know, there is there won't be much space to pass. That is one problem with this. Okay. You see, you can also keep it like this, push it like this. Okay. For easily moving it. Plus, let us see. Now this is what I said. No, you see the eyed, so that it can easily pass through as a guide. So when you are holding the tissue,
And they notice, doctor, there is an opening
yes,
downward for the...
yes. So if I'm holding the tissue, see, it will guide me to pass it through. Okay. This is, we can reflect it a little more. If I reflect it a little more, we can go more deeper. Just so that we can pass the instrument more deeper. Okay. See? So it is very, I just have to pass through here. Easily it will come out through the other one. This guides me. This eye will guide me. So that's, now say, I am going to pass it from here. Okay? Through the other. Same, on the same side I have taken it. Okay? Now I will release the lock. And I will, you can push it a little bit from here if you want to grasp it. And hold it. Okay? Hold. Fine?
Yeah.
Then I want to move it interdentally between the two teeth. Okay? For this, if you want, you can lock, otherwise it is okay. Okay? And now this is going to be, will it come? Let us see if it will come. Because in the goat it is a bit difficult.
It is.
See, it tore off. Get me another one here. The interdental in the goat, it is very tight because you know they're chewing, so it's
Can you do it
broad.
just here to see?
No problem, I can show it to you there. Thank you.
Yes, I know.
Let me first see if it passes interdentally. The contact is too tight, but I can get it.
Dr. Kang in prison.
No, I can get it. No, it's coming, no problem. Just that, you know, it's a broader contact. That is why. Because, you know, they chew and it gets attrited and... yeah. Alas, no problem. So, see from here, I have taken the bite, okay? Released it, hold it. Yes, bring it out. Okay, initially you can leave the remaining there, no problem. Let me just pass it interdentally. it has to come out. Earlier I got a point where it came out. In our human teeth it is easy to pass it independently, so you won't have a difficulty. Okay? Okay, got it. Halas, took it. Okay? Now same thing, when you're doing in the patient's mouth also, sometimes when you're pulling, this loop will get onto another teeth and lock there. Just be relaxed, just pull it, keep it normal, then you pull it. Okay? Halas? Then this, now we are doing this simple interrupted. So, now on the lingual or palatal, okay, from the inner side, from the inner side,
like hello.
yes, I will pass it from the inner side, release slightly. I can push it in a little more, pull it, following the curvature, and pull it out. Again pull, make sure that it doesn't lock anywhere. Yalla, come. Okay, done.
Now we tie a knot.
Now, no,
The most important.
now for tying the knot you need to bring this across,
Okay.
right? You need to bring it across. In the patient's teeth, easy, you can just, if you put one instrument and move it, it will pass independently. In this again, we have to pass it independently. Okay? In the human, yeah, yes, in the human teeth it is easy. There will be some spacing, you can easily bring it independently. In this case, we will pass it under the contact point, just because from the surface I cannot bring it independently. So I will just pass it under the contact point. Okay. Okay. Got it. Okay. And here. Clear? Always try to keep minimal length here on the free end. Why? If you have more length here and then you tie the knot, you are wasting a lot of length there. If it is just for one suturing, okay. But if you have to do multiple sutures, you will end up wasting the length. So try to preserve the length on this.
So the wasted, the
Wastage
end
happens
is this
here.
one.
Yes. This is the wastage end. If this is more longer, once you tie the knot and cut, that is going waste. So always try to keep this shorter. Okay, but enough for you to hold, not too short also. Okay. Then, now what happens is, now you have, see, this much length is there. Okay. You need to give, first we will start with the surgeon's knot. Okay, because that's what you will be doing. You will think, okay, I will start like this, then you will come all the way, you might get confused. Okay, so what you can do, shorten it for your, to hold it. Okay,
Okay.
I just folded it so that I can hold it like this.
Okay.
Clear? Then 2 clockwise. You saw my turns? 1, 2. Then I will hold this
Okay.
and I will pass it in. Okay?
This is the knot now.
Yes. And I am passing and I will tie the knot.
You cut it from here, right?
Yes, cutting is here. Okay? The side right.
Okay.
Then, so that was 2 clockwise,
Yeah. Now on.
1 anti-clockwise. Hold it. Okay? Opposite direction like this. Okay? Okay? One more clockwise. Hold it. Opposite direction.
Doctor, I'm
Okay.
just with a clockwise and
Yeah, me
how-
too.
See. 1, 2.
2, yes.
Hold.
Okay.
Lock.
Okay.
Okay.
The other way.
Then,
So yeah, anti-clockwise you come from the left.
Anti-clockwise, one, like this. Again one more clockwise, and clear? So this was the simple.
Two clockwise, then anti-clockwise.
Yes.
But then
Two clockwise,
Anti-clockwise.
one anti-clockwise, one more clockwise.
So,
Clear? Let us remove this now.
what is this suture?
Like I said, there are so many. This is just a modification of the iris. Khalas? Now, so that was the simple interrupted. Now, simple interrupted suture. Now, the interrupted or interdental figure of 8. In interdental figure of 8. Same thing. You go from here,
one.
then on this side you will come from the external surface. Earlier you came from inside. Understood? Here.
We come
You
with
go to the
buckle,
socket.
Yes.
We go distal lingual.
Yeah, see, no, see. Now, from the external buckle I entered. Clear? I exit from here. Here I will enter from the external surface.
It's always toward the tooth.
External surface. Clear? I'll show you.
Doctor, how many type of figure of 8 we have?
One is in the extraction socket, one is in the interdental, when the tooth is.
Extraction socket, we go in and then also.
I will show you that. Okay. Now again, see, same step. From the buccal, external I came. Khalas. Now I will go to the lingual. I came to the lingual. Okay. Okay. Now earlier, for the simple interrupted, what did I do? I entered from the inside.
Yeah.
This what I will do, I will turn the needle and I will come from the external surface. Right?
But Dr.
So,
external should be opposite. Like if you go mesobuccal, should be distal lingual.
here this is figure of 8 for interdental. What you are talking about in extraction socket.
So,
Understood? Don't confuse. This is interdental. I entered from here, same like the simple interrupted, but the second bite I am taking it from the external surface.
okay.
In the earlier I took it from the
Internal.
internal surface. In this I will take it from the external surface. So if you see, imagine it came like this, then it is coming like this. So you see it is an 8.
It's from
Yes?
this side.
Yes. Yes, it is a 8. Whereas the other one was came like this, and came. It's a loop. Simple. Okay? So I will take a bite from here, from the external surface. Okay? This is a bit thick tissue. Better if you use the this one. Okay? And knot again on the buccal. For the knot again I have to pass it interdentally. Okay, it should not come on the occlusal surface, but I'll just show you. It will come like this, and then I'll just show you the square knot. One time, hold it, close it. Okay. One anti-clockwise, hold it. Sorry. See, sometimes it gets tangled. No problem. So one clockwise I did,
Yes.
yes, and I will tie it, okay. One anti-clockwise, and I will tie it. So that becomes the square knot. Clear? One clockwise, tie. One anti-clockwise, tie. Square knot. Granny's knot.
Double clockwise,
One like this. One anti-clockwise.
then one clockwise.
One more clockwise.
It's between the surgeon and the square.
Yes. Clear?
Yes.
The square is one clockwise, one anti-clockwise. Yes.
Yes. Square knot.
Do you use it, doctor?
No, because the knot stability is very bad.
What is the
It will break off.
between clockwise and anti-clockwise?
It is no. It is to lock it. once you put clockwise, anti-clockwise will lock it. Okay, that is why we need to give one anti-clockwise. Clear?
Yeah.
So we did interrupted, simple interrupted suture, simple interrupted figure of 8, right? Now this is an extraction. The tooth is okay, it's still there. I think I'll show you here, but there is no tissue here.
We can doctor like in size.
We can, that's also possible. But just better if we have the extraction socket. No problem. Yes, this is enough. No problem. This is fine. Okay. Figure of 8. Tell me the entry points.
Buckle.
Monsieur buckle?
Yes.
Okay, this is Monsieur buckle. Okay, first bite. Okay, you can use this and you can do it. I'll just show it to you. Okay, or you can hold the, you can also use the tissue holding forceps. Okay, so I am coming from Monsieur buckle.
This to Barat.
No, just buckle.
No,
Mizio.
just
Mizio
buckle.
Barat.
Monsieur. See, because the tissue is very thick
No, because it expired.
and expired. No, I'll do it here only for you. No, it's okay, we'll do it here. Because I want you to see the socket. Okay, you can move all this.
Again, Doctor, we enter Mizzi Bakkal.
The Mizzi Barat.
Mizzi Barat, same.
ثم تروح.
Should be a cross.
Yes.
لا لا أول شيء تروح
It will come cross.
خط،
Okay.
بعدين تروح عكس،
See.
بعدين خط، بعدين تجي عكس. تصير ثانية.
See. Okay. Actually, even that way also you can do. If you do, you will get a cross. That is also right. It's not wrong. Multiple ways you can do. Okay. Now I came from here. Plus.
ميزي بارات.
From same side.
أيوة.
نفس الاتجاه.
Very thick. Okay. See, you can come either like this, or I can go here also, and then I can go here, come here, and then tie here, or I can do like this, where I will come in like this. Lift it from here. Okay, I can do this, then I can go across.
Just back.
External side.
External surface.
That's called the loop, right?
Hmm?
When you come from the external side each time, that's a loop.
Yeah. See, and whenever you're pulling this end, always make sure you grab the free end. Otherwise, what will happen? You will pull and this will come out. So keep this very safe. Okay? So now even if I pull, this doesn't go anywhere. If I release this, what will happen? When I'm pulling, this will come out. Then come across.
This to Baratel from
Yeah.
outside to inside.
Outside,
External.
inside. External to
Stair.
internal. You can take internal, external also, no problem. Okay, but it is easier this way. Oh, it's very thick. It's very thick. No problem. Wait, I'll just push it a little bit. Okay, got it. Okay. hold this end. Clear this end. Okay. And come across.
Now go to number 1.
Go to 1.
Yeah.
2 clockwise.
Without incising.
Without incising. 2 clockwise. Lock it. 1 anti-clockwise.
Is it granny, no?
No, surgeon.
No, surgeon.
Lock it. See, it has to come on the buccal side, okay? It shouldn't come to this side. This tissue is, that's why it's coming like that. Okay, and again one more. And on the buccal side. Okay, this knot should actually come here. Okay?
Is there a way, doctor, a certain way to guide the knot?
Yes, when you're pulling it,
Try to.
when you're pulling it, push it towards that side. If you when you're tying the knot, okay, you keep your finger here, and if you push it here, it will not there. I will show you when you are doing it. I will be with you. Okay, so we did simple interrupted figure of 8 and extraction socket. Now I'll show you horizontal mattress. Continuous we don't prefer.
The lock and without lock.
Without lock, but no need with lock. We will do without lock.
Is the question, doctor, is there enough like needles for us?
Yes, yes. If it's not there, we'll give you. Don't worry. Okay. So this is okay. Horizontal mattress. Okay. It is just imagine making a box.
Okay.
Okay. Who left?
He's,
That is okay. Let him keep it there. Keep it there, Omar. It is fine.
No, but I will switch the time.
Ah, خلاص. Okay, you can switch it.
حلو.
Keep it there. Wait, let it not come on this. Okay, خلاص, it's okay. Okay. So remember making a square. Okay. So now I will enter from here. Okay, point 1. Okay, I'm coming from here, point 1. I am holding the other end so that it doesn't go anywhere. Okay, then point 2.
Internal surface.
Internal surface.
It looks like it's simple interrupted.
Yes, but then we go to the other. Okay, then
From outside.
from
external.
here.
That's where we'll leave a loop. So
That is if you are doing a interlocked. We are not doing interlocked. We are just doing a simple horizontal. Is it bite enough? Deep enough? Is the bite good? Okay, it is good. No problem. Okay. Hold it. Okay. Now from the Okay. Hold it. Okay. And so now you see it's become a box.
Yeah.
Yes.
Clear? From here to here, to here, to here, and then you will tie the knot. Clear?
Yes. No, we're not. Yeah.
1, 2. Okay? Then see, if you keep your finger and guide it here, okay? Guide it here, the knot will come towards that side. Okay? Fine? 1 anti-clockwise. One more clockwise. Okay, this is how it is done. Then see, when you're cutting, this also I'll show you. When you cut the free ends, better if you, instead of leaving it like this and taking the scissors and just trying to cut it like this, it is always better if you first hold it, hold both the ends, how much distance you want, say 4 millimeters, hold it, lock it, then you use the scissor,
Cut easy.
cut it. This is easier. Okay, otherwise it might go here and there, difficult. This is very clear.
And we don't want to like cut very.
Don't cut very small.
Yes.
Then it might, if it slips, it will just open up.
So
Keep at least 4 millimeters. Okay, should not be too long, should not be too short.
But Doctor, on the figure of 8, if we want to remove all the suture after 1 week, from where we cut? Of the nut only? Is that
Yeah, near the knot. See, for example, you can consider this is like if it is a figure of 8. You don't have to cut here and here and here. No, just one point. See here, I will cut it here. Okay, but what I should remember, after I cut it, I have to see where is the knot. The knot is here, right? So I should not try to pull it out from here, because this will get stuck here and you will pull hard. Pull it from the knot. Hold the knot and pull it out. Simple. Clear? So that was the horizontal mattress. Now we need vertical mattress. Vertical mattress. Vertical mattress. Okay. Let's make
So here, it's a deep wound. It's better.
good. This is your tongue?
For me, can cut the suture after.
Okay. Okay, now this is a deep wound, correct?
Yes.
So the first suture will go deeper bite.
The far one, yes.
Yes, it will go a further bite. Okay. Actually, in this case, we'll need a longer needle actually. But I'll try to show it to you with this. Okay. So I got a deeper bite. Aiwa. Okay. Again, deeper bite on the internal side of the other one. Correct?
Present. Yes.
Balbotomy is much better than this.
Okay. Let's take it should be almost similar distance, but let us see if we can get it or not. Yallah.
It should be shallow, wide.
Deeper bite. First, both are deeper bites. Then more closer to the wound. Okay, Okay? Again, same distance on the other side, but closer to the wound. So,
Okay, yes.
okay? And then tie the knot. See, brought it together. Good. Then anti-clockwise. Now see, sometimes what happens, no? When you are pulling it out through this loop, make sure the whole thing comes out. The free end.
Yeah.
Okay? Sometimes otherwise what will happen? You will do like this. Okay? You will not take the whole thing out. You will end up holding like this. For example, you will hold this end here and you will try to pull.
Yeah.
So that you will end up with a ear. Don't do that. Clear? And then, like I said, clamp it together. See, now because I made the loop, that is why. Clamp it together. Get these scissors and start.
Doctor, what's the indication of
This is
what's the indication of using Doctor?
Vertical?
No, the surgical or the square knot, or always use surgical.
I prefer that because it keeps it more strong. The knot is more strong. Even the granny's knot also you can use. Like if, for example, if you're say the tissue, you don't need too much of tension of the tissue. You can use the granny's knot.
Small.
You can do
Okay? Don't use a square knot. It is not what we will do.